Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, we've got a full lineup this week, covering everything from new dementia care standards to infection control and regulatory updates.
We'll kick things off with a look at how senior living groups are responding to proposed dementia care requirements, then dive into new guidance around palliative care, from heart disease to advanced dementia.
Then we'll shift into resident experience, with a closer look at equity in long-term care and what families are saying about end-of-life care in the latest CAHPS survey.
We've also got two public health alerts you'll want to hear, one on the global rise of scabies and another on increasing pertussis cases in Mississippi.
And we'll wrap up with what communities can do to reduce risks through security upgrades, and a critical reminder about CMS non-compliance letters that could affect your Medicare payments.
It's a packed episode, so let's get into it.
So the first story we're looking at comes from McKnight's Senior Living, and it's all about the first ever national dementia care standards.
Yeah, senior living groups are pushing back on the staffing and training requirements in these first ever national dementia care guidelines.
Right? And their concern isn't really about the intent. Everyone agrees dementia care needs high quality standards, but about how realistic the requirements are.
Exactly. Some communities are saying that the staffing levels and training timelines could be tough to meet, especially with ongoing workforce challenges in senior living.
Yeah, it's not just about adding staff. It's about making sure the people already on the team get specialized dementia care training. And that's time, money, and resources.
And, that's important for residents. Specialized training means staff can better understand and respond to the unique needs of people living with dementia. Things like communication techniques, managing behaviors, and creating a calm environment.
Right. So this is one of those moments where the industry is trying to balance what's best for residents with what's actually possible for communities to deliver.
Exactly. And the key takeaway here is that we might see adjustments or phased rollouts of these standards to make them more manageable. But it's clear that dementia care is going to remain a big focus in the years ahead.
Our next story also comes from McKnight's, and it's all about a new statement from the American Heart Association on palliative care.
Yeah, the AHA is encouraging healthcare providers to bring palliative care into the conversation much earlier for older adults with advanced cardiovascular disease.
Right, and this is really about improving quality of life, not just at the end of life. Palliative care helps manage symptoms like fatigue, pain, or anxiety while still supporting ongoing treatments.
Exactly. For residents in senior living communities, this kind of care can mean fewer hospital visits and a much better overall experience, both for them and for their families.
And the AHA is trying to shift the perception that palliative care equals giving up. It's really about adding another layer of support, focusing on comfort and what matters most to each person.
Yeah, and for senior living teams, this is a reminder to partner with palliative care providers early on, especially for residents with chronic heart conditions.
The takeaway here? Integrating palliative care sooner rather than later can make a huge difference in a resident's quality of life.
All right, sticking with the theme of palliative care, this next story, another one from McKnight's, dives into new international standards aimed at improving care for people living with dementia.
Yeah, a panel of experts has come up with criteria for when someone with dementia should be referred to palliative care. And honestly, this could really change how and when support is offered.
Right now, referrals often come too late, when someone is already in crisis or very close to the end of life. These new standards aim to make those decisions more proactive.
Exactly. The guidelines emphasize early identification of residents who could benefit. Things like functional decline, frequent hospital visits, or distressing symptoms.
And for senior living professionals, this creates an opportunity to collaborate more closely with palliative care teams and ensure those conversations happen before things escalate.
It's also about quality of life. Palliative care isn't just medical, it's emotional, spiritual, and practical support for both the resident and their loved ones.
The big takeaway here? These new standards could help communities provide more personalized, timely, and compassionate care for residents with dementia before a crisis hits.
Next up, we're shifting gears to a really important topic: equity in long-term and post-acute care. This one comes from Provider Magazine.
Yeah, and it's not just about access to care. It's about making sure every resident receives care that's culturally responsive, respectful, and personalized.
The article highlights how disparities still exist in outcomes and experience, especially for residents of color, non-English speakers, and LGBTQ plus individuals.
Right? And it calls on communities to take a hard look at their policies, training programs, and hiring practices to close those gaps.
One thing I liked was the emphasis on building trust, especially through consistent communication, representation in leadership, and community partnerships.
And it's not just a moral issue. Equity leads to better care outcomes, higher satisfaction, and even stronger staff engagement.
The takeaway here? Equity isn't a side initiative. It has to be woven into every part of senior living, from the front desk to clinical decision-making.
All right, this next story comes from AHRQ, and it's about the CAHPS End-of-Life Care Survey, something that gives us a window into how families experience care during a resident's final days.
Yeah, this survey is unique because it's completed by the resident's family or caregiver after death, so it really captures the emotional and practical aspects of end-of-life care.
It looks at everything from communication and pain management to emotional support and whether the resident was treated with dignity.
Exactly. And the results can be incredibly useful for communities. They help identify where things went well and where there might be gaps in end-of-life services.
AHRQ also offers guidance on how to implement the survey, how to analyze the data, and even translated versions to make it accessible across different populations.
For communities that want to elevate their hospice partnerships or strengthen their internal protocols, this is a great tool.
Big takeaway? Listening to families after a loss can lead to meaningful improvements and help ensure every resident's final chapter is met with compassion and care.
Okay, this next one comes from Medscape, and it's about something we don't usually hear making global headlines: scabies.
Yeah, and the numbers are surprising. Scabies is on the rise worldwide, including in high-income countries like the U.S.
The article points out that over 130 million people are affected at any given time, and outbreaks are happening more frequently, even in long-term care communities.
Right, and while it's not life-threatening, it spreads fast in close contact environments and can be really uncomfortable for residents. Itching, skin irritation, and secondary infections.
Exactly. And in senior living, where residents often share common spaces and acquire close personal care, that makes scabies a serious infection control concern.
The story also emphasized the need for early detection, staff training, and prompt treatment, both for the infected individual and close contacts.
The takeaway? Don't underestimate scabies. It may seem like a small issue, but managing it quickly can prevent major disruption in a community.
All right, sticking with public health, this next one comes from the Mississippi State Department of Health, and it's a heads up about rising pertussis cases, also known as whooping cough.
Yeah, the state has issued an alert due to a noticeable uptick in cases. And while pertussis is often thought of as a childhood illness, it can be really dangerous for older adults too.
Exactly. For residents in senior living, especially those with underlying respiratory conditions, pertussis can lead to serious complications like pneumonia or hospitalization.
The alert includes updated stats, treatment guidelines, and a strong recommendation to make sure vaccinations are up to date, not just for residents, but for staff and visitors too.
And that's a key point. Many people don't realize adults need booster shots for pertussis, and in a senior living setting, that extra layer of prevention is critical.
It's also a good time to review infection control policies, things like respiratory hygiene, visitor screening, and staff education.
The takeaway here? Stay vigilant, stay vaccinated, and treat these alerts as an opportunity to tighten up protocols before an outbreak hits.
All right, switching gears to operations. This story from Provider Magazine looks at how upgrading security in senior living communities can reduce risks and actually help with marketing too.
Yeah, it's not just about locking doors. The article talks about preventing issues like elopement, unauthorized access, and even avoiding regulatory fines.
Right. And for communities serving residents with dementia or other cognitive conditions, these risks aren't just hypothetical. They're day-to-day concerns.
Exactly. And the tech has really improved. Things like electronic access controls, integrated video monitoring, and alert systems that work in real time.
But what's really interesting is how the article frames security as a value add. Families touring communities want to see that their loved one is cared for, not just clinically, but environmentally.
Yeah, having visible, modern security systems can build trust with families and referral partners, and even appeal to private pay residents.
The takeaway is that security isn't just a safety issue, it's part of your brand, and investing in it can make a big impact on both care and perception.
And finally, we're wrapping up with a story from the AHPS blog about CMS sending out non-compliance letters tied to the SNF quality reporting program.
Yeah, these letters are going out to communities that didn't meet reporting requirements, and it's going to impact their fiscal year 2026 annual payment update.
And the reduction is no joke. It's a 2% cut in Medicare reimbursements. For a lot of providers, that's a big hit.
Exactly. The letters include the reason for non-compliance and instructions on how to request reconsideration. But the deadline to respond is August 26, 2025.
So if you received one of these letters, don't sit on it. Review it carefully, gather your documentation, and submit that reconsideration request on time.
And even if you didn't get a letter, this is a good reminder to keep your reporting processes tight. Missing a deadline or leaving a field blank can cost your community in the long run.
The takeaway here? Compliance with QRP reporting isn't just a paperwork issue. It directly affects your bottom line. And now's the time to double-check your systems.
That's going to do it for this week's episode of HealthCap Weekly Wrap.
Yeah, a lot of ground covered, from dementia care and palliative standards to public health alerts and Medicare compliance.
And the common thread through all of it? Being proactive, whether it's updating care models, strengthening equity, or staying ahead on infection control and reporting, every step matters.
Absolutely. These stories remind us that senior living is always evolving, and staying informed helps us serve residents and their families with confidence and compassion.
Thanks so much for tuning in.
And don't forget, you can find more details about all these stories in the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
We'll see you next week.